Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
All right, Shakira, your hips might not lie, but they will go wide during pregnancy. So if you've ever thought, how is this baby going to come out during delivery? Or why is my pregnant waddle getting worse? Then this Pregnancy Pukeology Podcast episode 48 is perfect for you. It's all about the birthing hips. Did you know over 78% of pregnant moms have trouble sleeping at night? If you're lying awake in the middle of the night, tossing and turning, unable to sleep, then you should check out the Sleepy Lotion from 8 Sheep. It's a body lotion specifically formulated to help pregnant moms sleep better and also helps with common pregnancy pains like restless leg cramps, and back and hip pain. Over 40,000 moms have used the lotion and rate it 4.8 stars. It comes with a 60-day money-back guarantee too, and if you're not 100% satisfied, you can return the jar for a full refund. Go to 8sheep.com to check it out. That's the number 8 and the animal sheep. 8 Sheep. Love to save on this pregnancy cream? Well, then get 10% off now with your code NOMO, N-O-M-O, at purchase on 8sheep.com. Do you want to have some hilarious puke stories? Pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time anyway, with stories like hip bones connected to my Rice Krispie treats, snap, crackle, pop, and miracle baby blowout. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind birthing hips and what causes your hips to change during your pregnancy to get your body ready for delivery. Some exercises designed to get your hips ready for birth, how the baby's skulls are actually made to allow them to squeeze through that really small space at birth called the vagina, and the most common types of hip pain you'll experience during pregnancy. Plus, I'll never leave you hanging. So 4 natural ways to help reduce hip pain, all coming up in this episode of Birthing Hips, Pregnancy Pukeology Podcast, episode 48.
The science of puke, Pukeology.
Shakira had it right when she said, "Oh, I'm on tonight and my hips don't lie." I know I sound like Kermit the Frog, but you get it. Another song very popular is "Why Don't You Waddle Waddle?" Yeah, shake it, shake it. This all has to do with birthing hips. The only reason why you waddle, or I may add, I like pregnancy swag much better. And yeah, Shakira's hips didn't lie, but when she had her babies, guess what? They went nice and wide. So you may have heard about birthing hips before, or you actually may already have experienced it. Your hips are getting wider and wider with every month that you're pregnant. It might be one that you can explain just as a body shape or a change, but there's actually physiological changes that are occurring. Females that are talking about birthing hips usually sound, a little bit awkward, but think of it as the childbearing hips is a supernatural phenomenon. Women with their birthing hips are best described as giving a special ability to be able to bear children. And when that happens, your body communicates through hormones like relaxin and others to literally widen everything up. Now, some of you may actually have already talked to your OBGYN about having a C-section. And a scheduled C-section because of the fact that your hips just aren't shifting enough, or that your baby's noggin, their head, is way too big. And those are some different complications. But regardless, whether or not you're having a scheduled C-section, your body is still going to try to shift your hip bones outward. Hence why your feet, instead of being pointed straight, they literally almost in like a plie, like if you think of it as a ballerina status. And that's natural. That's totally normal because we women have the ability to bear children and they're coming down through the pelvis. Now, human hips will all vary considerably in size and shape. And again, that will affect how easy your child's birth down the birthing canal, down the vagina thereafter will be. Did you know that 80% of women actually have nausea or vomiting during labor. And that's all due to the vagus nerve being activated. When you bear down, like grunting, as you would on the toilet, or for sustained hours of time during active labor, this activates the largest nerve in the body, which is called your vagus nerve. This is responsible for decreasing your heart rate, increasing urination, defecation, meaning, yes, you'll probably poop. And if you're wondering if you will be that person, or if this is even very common, which I'm going to do a spoiler, yes, it is. We have an entire pregnancy podcast dedicated to it. It's actually called Pooping While Giving Birth During Labor and Delivery. So you can check that out. It's on episode 34. Again, only Dr. Puke No Mo would actually talk about this. So go ahead and get some answers to your most burning poop questions on that actual podcast. Now, going back to the vagus nerve. The vagus nerve we talked about decreases heart rate, increases urination, defecation, lacrimation, which means kind of like crying, right? But it also causes vomiting. And so in order to combat that response and give you a comfortable birthing experience, don't forget to add Nomo Nausea Band, a 3-in-1 essential oil infused pressure point wristband that is clinically designed to stop nausea or vomiting in seconds. Plus, it's trusted by doctors and OBGYNs across the US and used in hospitals across the world. But don't fear if your hospital doesn't give you one when you're in labor and delivery. Just bring your own. Go buy one. They're like right around $10. Buy those Nomo Nausea Bands on Amazon, or find them in stores, put them on your baby registry at Bye Bye Baby, or get it at your local CVS store. So if you want to learn more about the Nomo Nausea Band, go check out my favorite spot to buy it, nomonausea.com, or follow them on socials to stay all about in the know. Now, birthing is only half the story when we talk about the birthing hips from the mom, because the baby still has to make it out of the birthing canal, right? So in order to do that, your baby's head will pass through this vaginal canal, and it's a process called molding. Not crown molding, just molding. This is the actual process when the baby's head is quote unquote crowning. If you touch the baby's skull, you'll notice that the ridges on the actual bony skull of a newborn are comprised of two types of bones. So there's the frontal bone, obviously the front, and there's the parietal and the occipital. So the two frontal bones, they're actually not fused together, very malleable. Always think of the baby's head. They have what's called those soft spots, right? And when you have this very malleable, non-solidified bone, it allows it to bend in shape. It's kind of like one of those like squishy toys, right? So it holds a ball shape, but you can literally squish it and mold it, and then it returns back to its shape because it has that liquidity in it. So the process of birth consists of settling the baby's head into the mother's pelvis, followed by a long process of passing the head through the birth canal slowly within hours. Just to let you know, the first birth usually is right around like 6 hours long when it comes to labor. I'm not talking about active labor, but 6 to 8 hours is a very common assumption. For second-time moms, we're more cutting that in half, about 4 hours long. So the baby's head starts to resemble like a cone shape, especially if you're in active labor for a long time. Think of it as the baby comes out, the mom sucks it back in. During a contraction, the baby comes out, sucks it back in. And if you were a 1980s baby, like I was, you remember the movie Coneheads. Well, that's exactly what your baby's head is going to look like. But don't worry about it, guys. It does go back. And if you have a C-section baby, which I have as well, they have the most perfect, nice, round-shaped heads. Guess why? Because they didn't have to go through the birthing canal process. So the coning or the shape of the cone head is extremely normal. With time after birth, the cone shape starts to become round within a few weeks. So again, about a week or so. And some moms really switch the positioning of the baby. Just remember, SIDS does happen, which is sudden instant death syndrome. And the way to prevent it is put the baby on their back. I'm going to say it again, put the baby on their back so that they never have the trouble of struggling to be able to breathe, or that they get the actual mattress or the sheets of the crib stuck, and then they're no longer able to breathe and they asphyxiate. So it's very important. Babies on their back are happy babies. Now, why do babies have more bones than adults? Interesting, right? So babies do have more bones than adults. The adult body has about 206 bones. However, there are about 305 bones in an infant's body. This is because their bodies have much more flexible cartilage. And as the child grows in age, some of the cartilage gets harder and becomes a bone, and in different places. So different bones actually reunite and they make one bigger bone. So it's not that they are disappearing in the sense of what we all think, but it's kind of like the concept of Pangea when we were all continents, right? We were all together because our world fits together and then was shifted apart. So it's actually the reverse of it, right? So as a baby, we're all these different continents, and then it's like we do a reversal Pangea where we all come back together. Extra bones are most importantly present in the newborns in the skull when the baby is actually born, because the skull squeezes through the birth canal, so it passes through the canal much easier. Just think of it like if you have one big solid piece, it's much more difficult to squeeze it through a small area. But if you have a bunch of malleable smaller pieces, you can kind of squish it into the shape that you want, and then it kind of pops back out to being that round shape. The hardening of the baby bones is called ossification and is a gradual process of transformation of the cartilage into bone. Inside the mother's womb, until 12 weeks, the development of the babies or bones is actually complete. This time period between 8 to 12 weeks also during, in utero is actually called, I just totally lost the word. It's where the babies actually are forming. Organogenesis. There we go. Where the organs are forming. Organogenesis. I apologize for that. That was a brain freeze moment because I have had 2 beautiful babies, and baby brain is actually a thing, guys. Just in case you were wondering, it takes about 2 years to come back to it. But if you're curious about baby brains and those ridiculous pauses that moms take because we forget things that we should know commonly, go check out episode 32 and hear all of the neurology, all the science behind baby brain and why it's really a real thing. All right, going back from my baby brain. So again, now for the upcoming next 6 months, the infant's bones will continue to grow. So they become harder and harder and later ossify before the baby arrives into the new world. 2 small areas remain soft, and these are called the fontanelle, which is actually the frontal part. Again, this fontanelle is in the front while the other one is in the back of the baby's head. And these are what we call the soft spots. These softer areas help the progression of the baby's head through the birthing canal through a process of labor. The posterior soft spot, which is the posterior fontanelle, usually closes by the age of around 4 months after birth. However, the anterior spot, which is the anterior fontanelle, usually closes by the age of 18 months. And this is why it's a horrible thing to even think about shaken baby syndrome. But this is another example as to why, because they have these soft spots, you should never shake a baby. Their brain is still extremely fluid, I guess you could say. And so the knocking around will cause a lot of significant swelling. Round ligament pain. So there's several thick ligaments that actually connect to your womb through your groin area. This area joining the legs to the pelvis is called the round ligament. Usually the round ligament relaxes and tightens slowly. So the round ligament stretches with the growth of your baby and is likely to get strained. The rapid movement tightens this ligament quickly, like a rubber band snap, right? And causes sudden aching type of pain. I had the worst round ligament pain with my very first pregnancy, and it was during the first trimester. It's like my body, I had really great abs, and they just were like not willing to give up some space to my newly formed amazing son. And it was painful. So I'm going to give you some tips later on how to circumnavigate that, like what to do, what type of exercises. But if you are experiencing round ligament pain, and trust me, you'll know that it's round ligament pain because you'll feel it. It's literally the connection of your womb, your uterus there down towards the actual pelvic muscle. So when there is pain in the round ligament, you feel uncomfortable, but that's actually not unnormal, right? So all things considered, that is extremely normal, and a lot of changes will happen to your body during pregnancy. The round ligament pain could be sharp, it can be sudden, and usually on the right side, but it may happen on both sides of your lower abdomen. It'll usually last for about a few seconds or so. So the pain might happen as like a sudden movement. If you started laughing, coughing, sneezing, you roll over in bed, or you stand up too quickly, anything that causes that rubber band ligament to snap, it could potentially cause pain. So next, since that was a lot of pain, let's make your eyes tear up with some hilarious stories so that you're laughing in having tears of joy and not tears of pain.
Throwing up on a Tuesday? One puke story.
My hip bone's connected to my... Okay, so I was in a car crash and the airbag literally broke my hip. Ooh, because my leg was crossed over, and oh yeah, I was pregnant at the time. The pain was tremendous and I had to have a spinal, so I was awake while I was pregnant during the surgery of my actual hip because it was the safest way for me and my baby. I remember being... at my head was this nice doctor. When they arrived, I felt the medication in my back and I started to uncontrollably vomit. Oh my gosh, as soon as I laid down. The worst part of it is I was laying down and they were moving me so much. It's like rocking the boat on a cruise ship. The funny part is I told the surgeon in the middle of the surgery to stop banging so I could puke in peace. Let's just say giving birth was a breeze compared to that. Thanks, Sonia Slay, for that hilarious puke story. I'm so sorry that you got hurt into a car accident, but it is kind of funny that you were telling the surgeon what to do and how to do their job right. All for your puking pleasure. A Rice Krispie, snap, crackle, pop. I was at the chiropractor getting an adjustment, and clearly my hip were opening with lots of hormones and they were in full effect. And this was my third trimester. Usually you get to hear a few cracks, but I heard one that came literally from my pelvis. It was so loud and deep that I immediately started puking all over his fancy table. I decided to change doctors as I was so mortified. I puked because of the sound. Pregnancy is so weird. Thanks, Mama Mia 24, for that hilarious puke story. Wow, puking due to sound. That's a new one. Miracle baby blowout. We have 4 beautiful children and I got my tubes tied 2 years ago, or what I thought. I went into to finally fix my mom bod. I was getting a little lipo here and a tummy tuck because I just couldn't lose my mama kangaroo pouch. Well, they always take a pregnancy test prior to surgery, and guess what? I'm pregnant. I started arguing that they had the wrong pee, so I kept peeing. I was so upset, I literally started crying hysterically. The blubbering type was snot coming down my nose and throat, which caused me to gag, and I gave up my dinner from the night before. I guess my husband really did give me a high 5. 5 children, that is. Thanks, Leigh, Lee, I'm guessing, for that hilarious puke story. Do you understand that is like my worst nightmare? I've gotten my tubes tied as well, and I'm like afraid one day that they're literally just going to be like, oh no, I cut the round ligament instead. That actually does happen sometimes because a round ligament looks very similar to your actual fallopian tubes. So I will tell you that has been a very scary part of mine, personally, a nightmare, not necessarily a dream. Do you have a hilarious puke story that you just can't wait to share with me? Send it to me. Pukeology, Pukeology at nomonausea.com. Let's try that again. Pukeology, Pukeology at nomonausea, nomonausea.com. Or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
So we talked about why your hips go out. That's that hormone relaxin is one of the components, but also because of the fact that you are literally doing that like plie type of motion. All of these things move those hips out. And we talked about round ligament pain, how it can happen when you make these sudden movements of coughing and sneezing, sometimes just even laughing really hard, or the expansion of the baby. If you have a really small cage or a small abdominal area and you're really just pushing that baby's growing much faster than what your ligament can hold on to, you can start to have round ligament pain. So how is it that we can relieve this round ligament pain? If you, by ultimate means, at the very end of all of this, if it's still super painful, go talk to your doctor, and always remember, take acetaminophen, which is also called Tylenol, but consult your doctor because you definitely don't want to take any NSAIDs. NSAIDs are things like Aleve or aspirin or any of those guys, ibuprofen, because of the fact that they do function to mess up your platelets, meaning that they will give you an even like thinner blood, and you don't want that because pregnant women naturally have a tendency of bleeding a lot. And if you're taking these NSAIDs either prior to pregnancy and or during your first trimester, they've actually found that it has an increase in the number of miscarriages. And the reason why is because in order for your body to hold on to a baby, to hold on to the egg, it needs to have inflammation. And the way that NSAIDs or non-steroidal anti-inflammatories work is that they decrease inflammation. So, little highlight of the day. One day we'll go into how to get pregnant, since most of you guys already are pregnant, so that's behind you. But others, they do suffer from infertility, and I have a lot of friends of mine. So all of the natural things that you can do. So let's talk about natural ways to treat round ligament pain. Exercise. Maybe a little counterintuitive, but if you warm up that rubber band, right, that ligament, you warm it up, you stretch it. Stretching plays an extremely vital role in relieving pain because you're learning how to kind of push and pull, how to stretch that rubber band in the sense of not doing it quickly, but instead lengthening it, right? Lengthening it, and then you can go farther and farther and farther. And warming up your body, exercising, is a great way to keep everything warm. Now, if you're a person like me who is absolutely in love with their Peloton, and I do the stationary bike, I will tell you that your hip flexors, right, will get kind of cramped up in the front. And that's another thing that you can think of. But whenever I'm nice and warm, stretch at the very end of the exercise. But at least it gets me to be able to make myself much more malleable. Number 2, yoga. Prenatal yoga is so helpful, but make sure that you're performing it well. Make sure that you are able to perform it. So consult your physician before you do any new type of yoga. And I would caution if I'm saying this right, the hatha yoga, the really hot yoga, because your body is already being pumped with so many hormones like relaxin that you're really flexible, believe it or not, during pregnancy, or even more flexible. You can actually hurt yourself. I've actually heard of women literally popping their hip bone out. And the only thing that was holding it on was these ligaments. So you got to be very, very careful to not overheat your body and overheat these round ligaments. And of course, because of the fact that the baby is an organ system, so it gets about 15 to 20% of blood flow to the baby. You would never want to decrease the blood flow because your peripherals, your hands and your feet are getting so much blood because it's just so hot. So number 3, avoid sudden movements. Don't try to bend your body before coughing or sneezing or laughing, right? It really pulls on the ligament. So something that you can try. Belly bands are a great way. They go up underneath of it. I've seen them get really creative over the years, and belly bands are amazing. Or just take your hands, like the palm of your hands, and apply pressure down as though you were taking your pinky finger and it's going kind of into your pelvic region. Hold pressure and then cough or sneeze. Or if you know that your husband is the biggest jokester ever and he's literally telling you a joke that you might just pee your pants, do that. So hold it in so that you're not having that jarring, sudden movement on that round ligament. Apply warmth, a heating pad, a hot towel to the area. Notice that I'm not saying cover your entire body in a heating blanket. I'm saying just that area to help to soften it, to help to smoothen it. Always, number 5, a massage is always great. You can actually use some really great oils and you can really get in there. I know we talked about 8 Sheep, which is a lotion. Not only will it help you to kind of go to sleep with lavender, but it also is great for massaging, especially that area, because inflammation in the area around the ligament can happen because your ligament is screaming, saying, hey, I'm being stressed out. And so your body goes to try to help it by creating all of this adhesions. And the best way to get rid of it is to stretch, doing yoga or other stretching type of exercises, and then massaging it out. I don't know if you guys have ever heard of cupping, but again, that happens on muscle tissue, not necessarily ligaments themselves, but it's a great way to kind of get it to relax. If you've ever taken apart chicken, when you go to cook it, and you've ever pulled back the skin and you see kind of the little spider web looking stuff that's attached to it, those are adhesions. And that's what our body does to keep things sealed together. So really massage it out, just like you would massage it out or kind of cut it out, right? Of the chicken breast. That's the best way to do it. However, immediately consult your doctor if you're having severe pain, fever, chills, pain during urination, difficulty in walking, or pain that lasts for more than a few minutes, where you're just in constant pain. There might be something else that's going on. Like I told you that story before about I have a friend who was in hot yoga, was trying to do way too much. And she was like, oh my gosh, I'm so flexible. It's amazing. Boom. And she noticed she actually literally popped her hip out of socket. So calcium supplements, how do they play a role with when we talk about, hips and hip bones? The intake of calcium is extremely necessary and it's considered safe for all moms. While you're pregnant, a lot of times you have a low calcium diet and this baby is sucking the life literally out of you and out of your bones. So it's important to take a calcium supplement. About 1.5 to 2 grams of oral calcium is good. There are calcium, magnesium citrate. There's other different types of calcium that you can take. Just make sure that you can digest it. What's best beyond pills is going to be you're going to have real food, right? And if you are a patient that has preeclampsia, meaning high blood pressure, it's advised for you to actually take a reduced amount for preeclampsia. You can learn more about preeclampsia, also called pregnancy high blood pressure, in our Pregnancy Pukeology Podcast, episode 37, which talks about high-risk pregnancy conditions, not just preeclampsia, but it talks about what are those other risk factors, other things that could potentially happen that you might not know about. So go check that out whenever you get done listening to this one. So again, the women that are counseled to have an increase in the amount of calcium which is available in food-rich substances. So we should divide the dose of calcium intake, and it can be improved acceptable once your body has like a certain level of calcium. And we talked about it, the recommended dose that we say 1.5 to 2 grams, and it should be divided into 3 doses, preferably taken at meal times. Now, due to the interactions between iron and calcium, both supplements should not be taken together. So if you're chronically anemic, ladies, and this usually is you before getting pregnant or whatnot, so you're just continuing your iron pills, take those at 2 separate times. And iron actually made me feel very nauseous. This was prior to obviously finding no more nausea bands. But if you are one of those people that finds it, nauseating, take your calcium before dinner and then take your iron after dinner. This way you can just kind of like sleep it off, right? The reason why they interact with one another is because they inhibit the other's absorption. So they kind of battle each other out. If you're looking for the perfect prenatal vitamin and you just don't know which one to look for or what is it that you should be reading on the label, don't worry. I broke it all down for you in Pregnancy Pukeology Podcast episode 3, Why Take Prenatal Vitamins. Well, calcium supplements should be started as soon as the woman finds out that they are wanting to get pregnant. And then if they are pregnant, absolutely. So however, if calcium supplements have been started in the second half of pregnancy, they may actually reduce the risk of preeclampsia and eclampsia. So it has been proven that whether it was started in early pregnancy or the second half of pregnancy, it adds a benefit for the mom and the baby. So it's never too late to start taking calcium as a supplement or just increasing the amount of calcium inside of your diet. If you're wondering what gives you calcium other than, milk and yogurt and cheese and like the normal things you think about, go over and find out what foods that you should be eating. So the foods you should be eating, episode 16 gives you an entire list and why, and breaks it down into why some vegetables, why some fruits, why some things have calcium in it that you just might not know about it. Calcium supplements can be taken in the form of calcium citrate or calcium carbonate. If you do not want to consume, or if you don't consume enough that the baby is requiring, then your baby will literally suck the calcium out of your bones. I'm not even joking. They will take calcium from your bones. And again, this will decrease your bone mass, which could potentially decrease in general and increase your risk of developing what's called osteoporosis. We all know that menopausal women have a higher risk of osteoporosis. So keep up your calcium, not just during pregnancy, but even thereafter. An intake of excessive calcium may interact with your body's ability to absorb other minerals, and they result in constipation and kidney stones. A study showed that females who take about 1,500 milligrams of calcium daily have a lower risk of preeclampsia and premature birth. But again, the inability to absorb minerals is causing some unwanted side effects like constipation. So keep hydrated, ladies. That's all I can tell you. So pregnancy hip pain. How are the hips getting ready, right? Now that you stepped into the second trimester of pregnancy and you're ready to welcome this cute, delicious little bump, you might be a little out of shape. I hate to say out of shape. I just mean your clothes just don't fit, right? But all things taken in together, this is a beautiful natural process. So as your bump increases or as the baby gets larger in size and in weight, it exerts much more pressure on those joints and ligaments. And this is the main reason why people started having back pain in the second trimester. Think of your body as a scale, okay? So if your hamstrings are hurting, it's literally because the opposing muscle, which is your quadriceps in the front of it, are doing more work and that your hamstrings are weaker. And or it's because you're not as flexible in those areas. So remember, everything is like a tit for tat, a give and take. If you're having pain from your hip flexors, your back is going to literally like want to arch more. And guess what that's going to cause? back pain. And then as a back pain results, the pulling of your actual hips downward will cause that round ligament pain. So they feed into one another. So it's really important. It's kind of like a passage into pregnancy, but pain does start to increase. I know a lot of my friends started getting horrible sciatica during their pregnancies. Luckily, I didn't have sciatica until after I hit, middle age. But if you're wondering about what is sciatica during pregnancy or that extreme burning pain down your butt in your back, and I've got some great, 8 different ways, I believe, on how to stop sciatica in a natural way, go check out episode 31, Sciatica During Pregnancy. Now, if you've had back pain before your pregnancy, you might actually have an exacerbation. I was a cheerleader my entire life, all the way up through college, tumbling, doing flips, doing all kinds of stuff. And I've had a bad back. I was also a diver. So just imagine doing flips off of a board and then landing on water. Water is not that forgiving. It's kind of like hitting cement. So I will tell you, there's a lot of different injuries for, gymnasts or other type of sports athletes that you may have had, but you can actually get relief, right? So if you're naturally used to or accustomed to exercising, here's some really great ways to get your body ready for birth. Okay. So these are exercises that are hip specific. Deep squats, right? They're going to help to relax and increase the flexibility of your pelvic floor muscles and the perineum area. So the perineum is the space or what's between the vagina and the actual anus. So deep squats are really good. If you want an even deeper stretch when you're in the squats, take your elbows, press them out to the sides, and you'll notice that it will help to open it. Another great way to do that where you're not standing is in butterfly position. Take both of your feet, touch them together, the bottoms of your feet together, and try to pull them in towards your groin. As you do that, take your hands on each side of your knees. They look like a butterfly, hence the name butterfly, and just push and hold down. This will help to nicely open up everything in your pelvic area. Lean pushing, and that's another one. Again, so you're going to lean forward, pushing everything downwards so that you can feel that stretch and that lengthening. Practice, right? Practice relaxing methods for birthing. They have what's called Lamaze class. Practice breathing through it, okay? So what I want you to try to do, and this is something if you do have your partner, is a great idea, practice the contraction relaxation. And what I mean is, for example, if you're trying to, let's say, do a paired thing. Let's just say we're going to have one leg out and you're going to be leaning. Okay. So you're going to go down and try to touch your foot. As you lean, you're going to feel, you feel that over inside of your hamstrings, right? Then have your partner be behind you on your back where you push against them and then you relax it. And do it again, push against and relax. And you're going to notice that you're going to get more flexible as you go down. This is that contraction relaxation. So practice that. And it's the exact same during birth. Now, urinary incontinence can sometimes happen. Guilty as charged. Mine still never went away. If I jump and try to do 3 toe touches on a trampoline, you better believe I'm going to have a little pee. Some women too, they actually, whenever they sneeze, they pee themselves like every single time, even after a baby. But what I want you to practice is utilizing those Kegel muscles, right? Really squeezing, holding them for 10 seconds and relaxing them. I actually have an entire podcast dedicated to getting your vagina back to its normal self, okay? So it's funny that I talk about this, but I talk about it as perineal tears. Remember that everything is together. So when a ligament is attaching the muscle to the bone, and when you have that, you have to remember that it is a constantly changing situation inside in that pelvic floor area. So really having a really strong perineum area will actually help. You do that through awesome Kegel muscles. And an added bonus, ladies, is you become a little bit more horny. Some of you might need it or might not. But just kind of giving you that extra aside. And then back pain relief. So great ways, we talked about, if you have sciatica and stuff, but really stretching everything out, making sure that you have an open. I also love hip flexor relaxation techniques to where you are lunging like on your knee and you're pressing your hips forward. Another great way to be able to do that. You can't do it if you're in your third trimester, but is crossing over one foot over the other and really trying to bring that leg in so you get the opposite effect. Remember that all of these things are awesome for experiencing labor. So you're going to focus your mind and your body into how do I prepare? And the best way to do that is by practicing, because it's a workout, ladies, just in case you haven't experienced it in the past. But I do want to tell you that there's amazing ways to have a successful birth. I was an example of my first time pregnancy with only 3 pushes, and that was it. And my beautiful baby was out. But I want to thank you guys so much for joining me in today's Pregnancy Pukeology Podcast, episode 48, all about those birthing hips. I hope as of today that you now know what causes your changes in your hips, how to make your body ready for delivery, why the baby's skulls are made the way that they are in order to help squeeze through that birth canal, and then most importantly, natural ways to reduce hip pain, or the most common hip pain, which is round ligament pain. If you loved this episode, and if you love me, Dr. Pukenemo, please give me 5-star ratings or hearts for likes. And don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology Podcast in Pregnancy, episode 48, Birthing Hips.
Pukeology Podcast, edutainment at its finest.